Can scoliosis cause your shoulder pain? To understand how scoliosis can affect the upper extremity, especially the shoulders, we first have to understand a little bit about what scoliosis is. Scoliosis is an unnatural sideways spinal curvature, and it normally has rotation associated with this curve, making it truly a three-dimensional deformity or condition within the spine. Scolioses are measured by something called a Cobb angle measurement, which is an angle measurement, and this measurement needs to be 10 degrees or greater, and again, there must be rotation. The biggest thing about scoliosis is that it introduces a tremendous amount of uneven forces to the body. This affects body symmetry, and it disrupts it in an unnatural way. Where scoliosis actually occurs means it can affect different areas of the spine. It can affect the cervical spine, meaning we can have a cervical scoliosis. It can affect the thoracic spine, where it's affecting the upper or the middle back. And then, of course, it can affect the lumbar spine, meaning it's a lumbar scoliosis. Meaning that these scoliosis can develop at any one of these sections. The location of the scoliosis directly affects how the scoliosis affects the body or affects the person. But we know, since the spine is a three-dimensional section of the body, or a three-dimensional thing that's dealing with gravitational forces putting down, it's not limited to just that area, meaning if you have a thoracic scoliosis, it's not going to just affect your thoracic spine. Since it causes unnatural forces with gravitational compression, it can affect factors throughout your entire body, even down into your feet. So what are some factors that can contribute to what kind of symptoms that the patient is experiencing? Well, the most important thing to understand when it comes to scoliosis is that every symptom or every effect on the body is unique to that person. And it's based upon many different variables, not just where the curve is or the size of curve. Patient age could be a big factor here, because a lot of times as patients age with scoliosis, it tends to cause more things and cause more pain-like symptoms and cause more functional types of concerns. The causation factor, whether the scoliosis is an idiopathic or whether it's traumatic causation, whether it's neuromuscular condition is associated with scoliosis, what causes the scoliosis can directly affect how the scoliosis is affecting the body. The location can indicate the most likely area affected by the scoliosis, but it's not just limited to that. Meaning, if you have a lumbar scoliosis, you're more likely to have low back pain and things occurring with your lower extremity, but you're not limited to that. You can have some things that are being affected above, and vice versa. If you have a thoracic spine scoliosis, more likely to have thoracic spine kind of concerns, but you're not limited to that. You can have low back and leg issues as well. And then, of course, the severity. We tend to say that the more severe the curve is, the more likely it is to cause problems. But unfortunately, what symptoms the person is experiencing as a result of the scoliosis isn't directly related to size of curve, meaning we can have a patient with a 60, 70 degree severe scoliosis and have no symptoms at all, and then a patient with a 30 degree curve and have significant symptoms or pain or discomfort. So it's not always related to the size of curve. That's why I don't like these classifications so much as mild, moderate, severe, or even very severe scoliosis cases, because it's only related to the size of curve and the treatment protocol being surgery. Mild, moderate, severe, or very severe scoliosis is not taking into consideration the effect it can have on the person's body, meaning somebody with a mild curve could have a severe effect as a result of the scoliosis, and somebody with a severe scoliosis may have mild effects as a result of the scoliosis. So it's not taking that into consideration. It's only classifying it based upon size. So how does scoliosis affect the shoulders? Well, simply enough, scoliosis disrupts overall body symmetry. And once you affect body symmetry, you can affect a lot of things. If the spine isn't straight, it causes the shoulders to sit unevenly. And it can also cause them to rotate, meaning creating one more forward and one more posterior or more backwards. This uneven forces of scoliosis can make the shoulders sit uneven, can make one more shoulder blade protrude, and it can cause these, in fact, scoliosis. One of the earliest signs of scoliosis in adolescents is uneven shoulders. So shoulders are one of the main things that we notice when somebody has scoliosis. So if we have an unsymmetrical alignment in the upper body, meaning in the shoulders, from adolescence, it can lead to problems that occur later on in life, and it can lead to pain and discomfort. In fact, when this is happening during adolescence, where is something called shoulder deformity that can actually occur. Meaning that just like when a patient develops scoliosis and we see it in the thoracic spine and we notice something called rib deformity. Rib deformity is where the ribs are physically growing in a asymmetrical alignment, meaning one side of the ribs are growing more bowed and the other side of the ribs are growing more horizontal, more flat. Well, unfortunately, anything that's attaching to the spine because of the uneven forces can cause a deformity. So not only are they uneven in alignment, they can be uneven in structure. We can have clavicle deformity from one side to the other. We can have shoulder blade deformity from one side to the other. And this asymmetrical development can lead to asymmetrical biomechanics, which unfortunately can lead to pain and malfunction that can occur in the spine. And this is particularly true in scolioses that affect the upper thoracic spine and the cervical spine, because the more the muscles are pulling on the bones during growth and development, the more of this deformity can actually occur. Even if there isn't any deformity, we know that asymmetry causes these muscles to work harder and work asymmetrically. As a result of the scoliosis, this can lead to discomfort and pain. And also as the spine shifts out of alignment as a result of the scoliosis, it can affect the nerve tissue that goes into those parts of the body, which can cause, again, more pain and discomfort. So to sum this up, it's uneven forces. It causes the shoulders to cause pain. It can be because of deformity. It can be because of nerve pressure, and it could be because of the muscles are working asymmetrically from one side to the other. So how do we help patients that actually have shoulder pain as a result of their scoliosis? Well, the first and foremost, I'll tell you that if you have scoliosis, being proactive towards your treatment, not letting your curve progress and become larger, especially in the adult stage, because we know adult scoliosis cases that progress are more likely to cause pain. Being proactive and keeping your scoliosis under a certain size or not letting it progress in the adult stage is one of the best treatment options, because you're going to take care of it before it actually becomes a problem. But if you're starting to already experience shoulder discomfort, upper traps, and you're starting to notice that these things are becoming more tight or more painful or less mobile, you have to work with scoliosis on a structural level. Meaning, if you're just dealing with shoulder range of motion and trying to reduce your shoulder pain, but you're keeping the scoliosis the same and not dealing with the curvature itself, anything that you're doing to help your shoulder pain is not going to be long lasting, because you're not addressing what's causing it. So trying to reduce the size of curve is one of the main things that you want to try to do to try to improve what you're feeling in your shoulder. So when we look at what the main symptom is in adolescent cases, it's a postural deviation, including uneven in shoulders and hips. And we know that this asymmetry occurs during growth in adolescent idiopathic scoliosis and progresses during growth phases that can alter growth and development of the shoulders, clavicles, and scapulas. And then you go into the adult form and the curves progress because of compression of gravity, which can affect the nerves that are exiting into the shoulders. You can see how it's very likely for a patient with scoliosis, especially in upper thoracic or cervical spine, to develop shoulder symptoms and pain. So therefore, reducing the curve, supporting the spine, dealing with the scoliosis in a conservative approach to help reduce the curve and reduce this asymmetry is literally the most effective form of treatment for somebody who has shoulder discomfort, shoulder pain, and scoliosis. Here at Scoliosis Reduction Center, we offer many proactive treatments to address the curve size, whether you're having shoulder pain or not. If you are, definitely that's something that you want to try to reduce and deal with. But even if you have scoliosis and you're concerned about what could be occurring in the future, dealing with the curve early and being proactive is really one of my best advices if you have scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.